Why, hello, nurse or student nurse or nursing leaders. I just want to welcome you and thank you for joining us this upcoming Tuesday, February 24th, WNA's Nurses Day at the Capitol. I hope in advance that you will find the day incredibly rewarding and that you feel that you've made a difference in the world of policy as we advance important issues both for nurses and the patients that we care for. So my name is Gina Denick Champion. I'm the executive director and lobbyist for the Wisconsin Nurses Association. And my goal over these very short minutes is to just provide an overview of our legislative priorities for Nurses Day. These are the topics that we will be meeting our legislators in the afternoon to share our priorities and our asks that you'll be comfortable with sharing. So first of all, I want to start with there is a Senate. The Senate has already met and acted on a number of bills. So I will let you know where the status of these are. And as I speak today on Thursday, February 19th, the Assembly is actually having a floor session where they're voting on a multitude of legislative proposals. So we may have some updates for you when we get to the day. But here are the three topics that we're hoping you will be comfortable with after we share all this information with you a little bit today, but then more when you get to Nurses Day at the Capitol. So the first emerging policy, and we're calling it supporting clinician well-being. And the second is planetary health policy for nurses, impact of data centers on our health, and the protection of the title nurse by use of artificial intelligence. So let's start with the Clinician Assistance Program. There are two bills, an Assembly bill and a Senate bill. Assembly Bill 799 and Senate Bill 802 that WNA has providing information and support on. The issue for why this legislation has emerged is that nurses' response to stress is obviously diminishing our physical and psychological abilities to, our health, along with in some cases, some ineffective coping to the point where it is really impacting the mental health of the nurse. So we will share at our session that in our 2024 RN workforce survey, over 1/3 of our nursing workforce ranked their health since the COVID-19 pandemic as worse or much worse. We also had another study or report that we were able to glean that the impact of workplace violence towards nurses has also resulted in some psychological issues. So the purpose of this clinical assistance or this demand is that that our nurses are reluctant to reach out for help due to stigma or just feeling of hopelessness. There's nothing that can be done about it. Access to safe and confidential resources, concerns that they may lose their job by disclosing how they're feeling or what how their ineffective coping might impact their job, that they might be reported to the Board of Nursing and disciplined. And the other thing that we're finding that nurses, they're putting their needs above their own, which we know is not healthy. The solution that has been brought forward is to establish a statewide, confidential, voluntary assistance program that encourages early help seeking and protects both our patient safety and clinician well-being. If we're not at the top of our game, we know that patient safety, quality care can be affected. So two legislative bills have been brought forward and have already had a public hearing. And WNA spoke in terms of we really like the model that's been described in these two bills. There is the proposal that the financial support for this statewide entity will result in a $70 per nurse licensure fee. We don't find that acceptable. We and this legislation is not just for nurses, but it would be any healthcare provider paying that $70 when you renew your license every 2 years. WNA believes that there are other sources that can be tapped, so to speak, to help us not have to pay the $70 fee. So that's where this bill is today. And like I said, your ask will be that we like the model that's in the legislative. Our biggest concern is that the $70 fee on top of already on top of our licensure fee. Planetary health and impact of data centers. So we are learning that the health impacts of data centers are creating significant localized and growing environmental health threats that directly affect patient outcomes as far as well as our community well-being. We know that we need power in order to create a digital world, but their rapid growth has a consequence for the health of the communities where they're being built. Also, decisions about data center development seems to ignore the issues related to impact on the air, our water, the climate, and overall our community well-being. WNA believes that as nurses, we will see, or we're seeing now, the impact of these data centers. We are already paying attention to air quality and respiratory health. We're seeing folks that have been impacted by climate change, heat waves, wildfire smoke last year, a lot of that, water use and community resources for water, and the energy burden that is now being passed on to the members of the community. So all are being impacted by this. So that's the issue. The summary is that there have been 3 different legislative bills that have been brought forward. None of these address the environmental health impact. So it's more about disclosing that the different cities or the village boards or where this is going to happen is that there has to be disclosure that they're working with an AI company to build data centers within that community. That talks more about data and efficiency study. It's a study, but it doesn't address the health issues. And then others really putting in some certain requirements to data centers, but it only addresses the use of water. So our solution, and again, as I stated earlier, that we are ending the end of the legislative session is really coming to a close. So any bills that have not been passed by the Senate or the Assembly or will go away and need to be introduced in the next legislative session, which will start in the beginning of 2027. So what we're requesting, there is an option that we thought would be helpful is legislative councils provide the resources to legislators regarding the statutes already in place related to specific or all pieces of legislation. So this legislative council, we're asking, they can form study committees, and they usually happen in the summer of the toward the end of the session. So our session ends, like I said, at the end of 2026, but there's going to be very little activity. So it's a good time for study committees to be formed and during the summer. And then they provide a set of recommendations. Our ask of our legislators is, could they request a legislative council study committee that to review look at the economic, environmental, and health issues related to data centers. And that's the only ask that we will have of you in regard of the data centers. So we're really hoping that that will feel like an easy ask for you. And again, we will have lots of information available to you and the legislator. Our last is protection of the title nurse that is being used by artificial intelligence. So the issue is AI is being used in communication with patients via bots, avatars, other sorts of digital. The kicker is that they're being depicted as nurses. So the avatar looks like a nurse. The bot looks like a nurse. Patients in this case is that patients think that they're talking to a nurse, a human nurse, when in fact it's a non-human working off of algorithms, as you know. So this misrepresentation of us can really mislead the public into believing that this non-human avatar has a state license to practice as a nurse. It implies accountability that does not legally exist. Nurses, and we have our license, are accountable to the care of our patients. AI, I don't know, there's no board because it's non-human. And it really can blur the distinction between the nurse's clinical judgment, critical thinking, empathy, moral agency, are the sets and skill sets of nurses. What the avatar is, we know, it's talking based on the algorithms that have been built, and not always, using all those other important skill sets that nurses can ascertain and use versus, the algorithm. So what our solution is we want AI systems to stop depicting avatars of nurses, bots of nurses, even simulation where it says my name is nurse so-and-so. We want that stopped. And the way we can do that is we need legislation to prohibit its use. And so our ask for our legislator is that please support legislation that prohibits AI systems from using the title or portraying it as a nurse. Legislation, we believe, will probably extend beyond just nurses. We know that our other healthcare professionals are also seeing this happen to them as well. So there may be some legislation out there by next week, Tuesday, which I will provide an update on. So that's what I have for you. There will be more information when you go to WNA's the Nurses Day at the Capitol website, which is there for you, as well as throughout the day of our Nurses Day at the Capitol. We will have infographics for you and how to communicate these issues with your legislator. So thank you again for being part of our day next week. And I wish you the best success. Thank you. And I look forward to hearing from you. Thanks.